The newest information that we're learning is how hearing affects brain health. And this is sort of a game changer when I'm counseling patients in the clinic. It's not just how you're getting along anymore in your day, but we now know that hearing affects, let's see, do I not have it in the presentation mode? Here we go, hang on.
Yes.
Okay, great. We now know that hearing loss causes depression, anxiety, reduced social activity, isolation, lack of employment, decreased income, loss of independence, balance impairment, falls, and the biggest one is cognitive decline. So we want to address all of these issues. We know that if we test people's cognition at time 0, and then we fit folks with either hearing aids or cochlear implants depending on their hearing level for as little as 6 months, and we retest cognition, scores go up. So that changed the way I counsel patients. It's no longer an association, which we've known for 20 or 30 years now, but it's really a causal link. And when we treat hearing loss aggressively, we can keep the brain neurons stimulated. This slide is really the take-home message for Dr. Lewis and I in our mission, is these statistics are terrible. So less than 15% of adults who could benefit from a hearing aid, if you can believe it, get one. And even worse, only 5 to 7% of people who could benefit from a cochlear implant get one. So Michael and Bob, you're in the 5 to 7%, but this is why we're trying to do events like this and educate folks. We go to audiology groups, we go to patient groups. We're trying to get the word out that we need to do better in treating hearing loss. And so let me just zip along to I love this picture because these were the old-fashioned hearing devices. We're hopefully doing better than some of these examples. So once you're a candidate, people are scared, right? They're scared when they come to me because this is no longer an external device. This involves a surgery. And so my job is to educate you about the surgery and what it entails. It's not brain surgery, although I do that, but this is not that. This is external to the brain into the cochlea. It's a same-day procedure, so you come in the same day, go home the same day, and Michael can explain how his recovery was, and so can Bob. So it involves a general anesthesia. We put you to sleep with a breathing tube. I make a little incision behind the ear there, and I tuck the electrode under the chewing muscle, make a little pocket under the chewing muscle, and drill the bone behind the ear, approaching the cochlea, and then make a small fenestration or hole in the cochlea, thread the electrode in, and then close the incision. It takes about 2 hours for the surgery, and then you can go home the same day. I see you 1 week post-op just to check the incision, make sure it's healed, and then Dr. Lewis sees you anywhere from 2 weeks to 4 weeks in that window for activation. When we get people from coming out of town, we try to get earlier activation for them. We just want to make sure the incision is healed and without signs of infection. Common side effects, it's an incision, so it can hurt a little bit. Usually Tylenol and some narcotic for a few days takes care of it. Most people don't complain of too much pain. You guys can be testament to that. Let me know if I'm wrong. Dizziness can be an issue after surgery. That usually lasts anywhere from a few days to a week. I usually give some steroids to calm the inner ear down if that happens. A lot of patients have no dizziness, but some patients do have some dizziness after surgery. Uncommon side effects would be an infection. It is an artificial device that goes in the body. It's very uncommon because we do give antibiotics around the time of surgery. Meningitis can be a complication that I've never actually had a patient with meningitis because we give vaccines against meningitis before the surgery. That used to be a bigger problem many years ago. And then after the surgery and your incision is healed, Bob is waiting for his activation time. And then I pass you back over to Becky, who activates and then counsels you on rehabilitation, how to really stimulate your brain to relearn to hear, and then sees you a few more times to adjust the maps. And Michael can speak to that. And hopefully it's a kind of a game changer in your life. And I want to hear from Michael how that's been for him.